Did you know that your daily shower routine could be putting unnecessary stress on your heart without you even realizing it? What if I told you that simple changes to how you bathe could help protect you from serious health complications as we get older? After more than 20 years treating patients, I've seen too many cases where something as routine as taking a shower led to emergency room visits. Just last month, I treated a 68-year-old gentleman named Carlos, who collapsed in his bathroom during what seemed like a perfectly normal evening shower. What happened to Carlos could happen to anyone, and today I'm going to share what every person over 55 needs to know about bathroom safety and heart health. The truth is, our bodies change as we mature, and what felt comfortable and safe in our younger years might need some adjustments now. Your heart, your blood vessels, and your body's ability to regulate temperature all work a bit differently than they used to. This doesn't mean anything is wrong with you. It simply means we need to be a little smarter about our daily routines. Why do some people seem to maintain excellent health and energy well into their 70s and 80s? What simple mistake might many of us be making every single day in our own bathrooms? And how can you make small changes that could make a big difference for your heart health and overall safety? Stay with me until the end, and I'll answer all of these questions with information that could truly help you feel more confident about your daily routine. Before we start, please subscribe to our channel and turn on notifications so you don't miss important health information like this. Tell us in the comments which part of the world you're watching from. We love getting to know our viewers better. Let me start by explaining what happens inside your body when you step into that warm, relaxing shower. Think of your blood vessels like the plumbing in your house. When you turn on hot water, the pipes expand to let more water flow through. Your blood vessels do something very similar when your body gets warm. They open up wider to help cool you down, just like opening windows on a hot day. This process is completely normal and healthy. However, as we get older, our hearts don't pump as strongly as they used to, and our blood vessels become a bit less flexible. Many people in our age group also take medications for blood pressure, diabetes, or other conditions. When your blood vessels suddenly open wide from hot water, your blood pressure can drop quite a bit. Your heart has to work harder to pump blood to your brain and other important organs. The problem becomes more serious when we add other factors. Maybe you've just finished dinner, so your body is already working hard to digest your food. Maybe you're taking medications that affect your blood pressure. Maybe the bathroom is small and gets very steamy, making it harder to breathe comfortably. All of these things together can create a perfect storm that puts extra stress on your cardiovascular system. Medical research shows us that people over 60 are at higher risk for what doctors call orthostatic hypertension. This fancy term simply means that your blood pressure can drop suddenly when you change positions or when your body temperature changes. This is exactly what can happen during a shower, especially if you're not aware of the risk factors. Now let me share with you the 5 most important bathing habits that deserve your attention if you want to protect your heart and stay safe in the bathroom. Bathing habit number 1, using water that's too hot for your age and health condition. Many of us love that feeling of stepping into a really hot shower, especially on cold days. It feels wonderful and relaxing. However, water temperatures above 102 degrees Fahrenheit can cause your blood vessels to open very wide, very quickly. Think of it like opening all the windows in your house at once on a hot day. The temperature change is dramatic and immediate. When this happens, your blood pressure can drop 15 to 20 points in just a few minutes. For someone who already has blood pressure concerns or takes heart medication, this drop can be enough to cause dizziness, weakness, or even fainting. Carlos, the gentleman I mentioned earlier, was using water that was probably around 110 degrees. His blood pressure dropped so suddenly that he became dizzy and fell, hitting his head on the bathroom tiles. The good news is that you don't have to give up warm, comfortable showers. Water between 96 and 100 degrees Fahrenheit will still feel warm and pleasant, but it won't cause the dramatic blood vessel changes that can be dangerous. Many people find that after a week or two of slightly cooler showers, they actually prefer the feeling. You'll step out feeling refreshed rather than overheated and tired. Remember, if you take blood pressure medications, especially ones called ACE inhibitors or beta blockers, your body's ability to adjust to temperature changes is already affected by these medicines. This makes it even more important to use moderate water temperatures. Bathing habit number 2, taking showers immediately after eating meals, especially dinner. This is something that catches many people by surprise. After all, when is a shower more appealing than after a good meal when you're feeling relaxed and ready to wind down for the evening? Unfortunately, this timing can create additional stress for your cardiovascular system. When you eat, especially a larger meal, your body sends a significant amount of blood to your digestive system to help break down and absorb your food. This is normal and healthy. However, when you step into a warm shower right after eating, your body also needs to send blood to your skin to help regulate your temperature. Suddenly, your heart is trying to supply extra blood to 2 different systems at the same time. Research from cardiology journals shows that people over 55 who shower within an hour of eating are more likely to experience what's called postprandial hypertension. This means your blood pressure drops after meals, and adding the blood vessel changes from a warm shower makes this drop even more significant. The solution is simple, but requires a small change in your routine. Try to wait at least 90 minutes after a substantial meal before taking your shower. If you've only had a light snack, an hour is usually sufficient. Many of my patients find that this timing actually works better for their evening routine anyway. They have time to relax, maybe read or watch television, and then enjoy a peaceful shower before bed. If your schedule absolutely requires you to shower sooner after eating, keep the water cooler and limit your shower to 5 minutes or less. Also, make sure to move slowly and deliberately, especially when getting in and out of the shower. Bathing habit number 3, making sudden temperature changes when entering or leaving the shower. Picture this common scenario. You're standing in your cool bathroom and you step directly into hot shower water. Or you finish a warm shower and step immediately into the cool air of your bathroom. These sudden temperature changes cause your blood vessels to either open wide very quickly or clamp down tightly very quickly. When you go from cool to hot suddenly, your blood vessels open and your blood pressure drops rapidly. When you go from hot to cool suddenly, your blood vessels clamp down and your blood pressure can spike upward just as rapidly. Both of these changes can be hard on your heart, especially if you have existing heart disease, high blood pressure, or if you're taking medications that affect your cardiovascular system. The answer is to train yourself to make gradual temperature changes. Start by running slightly warm water, not hot water, when you first turn on the shower. Let your body adjust for 30 to 60 seconds before gradually increasing the temperature to where you want it. When you're ready to finish your shower, gradually turn the water cooler over the last minute or 2, so your body adjusts slowly. After you turn off the water, don't immediately step into the cool bathroom air. Stay in the shower area for 30 to 60 seconds, allowing your body temperature to start adjusting gradually. Many people find it helpful to keep a towel within easy reach so they can wrap up before stepping out completely. These gradual changes might add 2 or 3 minutes to your shower routine, but they can make a significant difference in how your cardiovascular system handles the experience. Bathing habit number 4, taking long showers in poorly ventilated bathrooms. There's something very relaxing about a long, warm shower, especially after a busy day. However, extended time in hot, steamy environments can gradually dehydrate your body and cause your blood vessels to stay opened wide for longer periods. This sustained stress on your cardiovascular system can lead to problems, especially in small, poorly ventilated bathrooms. When the bathroom fills with steam and the air becomes humid and warm, you're essentially creating a mild sauna effect. While saunas can be healthy when used properly, an accidental sauna in your bathroom can cause gradual dehydration and sustained changes in blood pressure that your heart has to work hard to manage. Many people don't realize they're becoming dehydrated during long showers because they're surrounded by water. However, the heat causes you to lose fluids through your skin, and the humid air can make it harder to breathe comfortably. This combination can lead to dizziness, weakness, or feeling lightheaded when you finally get out. The safest approach is to limit your showers to 10 minutes or less, especially if your bathroom tends to get very steamy. If you enjoy longer showers occasionally, make sure to improve ventilation by running the exhaust fan before you start and keeping it running for several minutes after you finish. If you don't have a good exhaust fan, Consider opening the bathroom door slightly or cracking a window if privacy allows. Some people find it helpful to keep a small cup of cool water in the bathroom to take a few sips during longer showers. This helps prevent dehydration and can make you feel more alert and stable when you're ready to get out. Bathing habit number 5. Ignoring safety measures that prevent falls and injuries. Falls in the bathroom are incredibly common and can be especially dangerous for people in our age group. When you combine wet surfaces with the potential for dizziness from temperature changes or blood pressure drops, the risk of falling increases significantly. A fall in the bathroom isn't just about bumps and bruises. When Carlos fell after becoming dizzy, he hit his head hard enough to cause bleeding in his brain. Even minor falls can result in broken bones, especially in the hips or wrists, which can take months to heal properly and may affect your independence. The key is to think of your bathroom as requiring the same safety considerations as any other potentially hazardous area in your home. Non-slip mats both inside and outside the shower are essential, but they need to be in good condition and properly secured. Grab bars installed by professionals can provide stability when stepping in and out of the shower and while washing. Good lighting is crucial, but often overlooked. Make sure you can see clearly in all areas of your bathroom and consider installing night lights for those middle-of-the-night trips. Some people find shower chairs or benches helpful, especially if they have any balance concerns or if standing for extended periods is uncomfortable. These safety measures aren't signs of weakness or aging poorly. They're smart precautions that allow you to maintain your independence and confidence in your daily routines. Now that you understand these 5 important habits, let me share some practical steps you can take starting today to make your bathing routine safer and more heart-healthy. First, check your water heater settings. Many water heaters are set to 140 degrees Fahrenheit or higher, which is unnecessarily hot for bathing. Consider having it adjusted to 120 degrees. This temperature is still hot enough for cleaning and laundry, but reduces the risk of accidentally scalding yourself or causing dramatic blood vessel changes. Second, create a new routine around mealtimes and bathing. If you typically shower after dinner, try moving your shower to before dinner, or wait until at least 90 minutes after you've finished eating. You might find that a pre-dinner shower actually helps you feel more refreshed for the evening. Third, practice the gradual temperature change technique I described. Start with lukewarm water and gradually adjust. When you're finished, gradually cool the water before turning it off completely. Take your time getting out and dried off. There's no rush, and these few extra minutes can make a real difference in how your body handles the transition. Fourth, assess your bathroom safety. Walk around and honestly evaluate whether you have everything you need to prevent falls. Good lighting, non-slip surfaces, grab bars, and clear pathways are all important. If you're not sure what you need, many hardware stores have staff who can make recommendations based on your specific bathroom layout. Finally, pay attention to how you feel during and after showers. If you ever feel dizzy, weak, or unusually tired, these are signs that something needs to be adjusted. It might be the water temperature, the length of your shower, or the timing relative to meals or medications. There are a few important things to keep in mind as you make these changes to your routine. If you take medications for blood pressure, heart conditions, or diabetes, these changes are especially important for you. However, never stop or change any medications without talking to your doctor first. Some people with certain health conditions may need additional precautions. If you have a history of fainting, severe heart disease, or frequent dizziness, discuss these bathing safety tips with your healthcare provider. They may have specific recommendations based on your individual health situation. Also remember that if you have a pacemaker or other cardiac devices, sudden temperature changes can sometimes affect how these devices function. Your cardiologist can give you specific guidance about temperature limits that are appropriate for your particular device. If you live alone, consider letting a family member or friend know about these safety changes you're making. In an emergency, having someone who understands your routines can be helpful. This information is educational and doesn't replace the guidance of your doctor. Never change or stop a treatment without professional supervision. The goal is to give you practical information that helps you have better conversations with your healthcare team about staying safe and healthy. Thank you for taking the time to learn about these important safety considerations. Your health and safety matter, and small changes in daily routines can make a big difference in how you feel and how confidently you can maintain your independence. If this information was helpful, please give this video a like and share it with friends and family members who might benefit from these tips. We'd love to hear in the comments about which safety change you plan to try first, or if you have other bathroom safety tips that have worked well for you. You'll notice we have 2 videos on the screen now. I'm sure you'll enjoy continuing to watch more content like this that can help you stay healthy and safe as you enjoy this wonderful stage of life.